thoughts about the presentation this morning?
I thought it was very good, very informative.
And just in case you're thinking, am I like going to be on the spot here because there's only a few people? You're not going to be on the spot, but there are only a few people here. So feel free to unmute and talk as much or as little as you want. We have some options for you to interact in other ways too that we'll tell you about in a minute. But so, okay, Tammy, you liked it. I'm assuming if you came back this afternoon that you felt like the content was informative and helpful. Andy, what do you think?
I was unable to make it this morning. I had a conflicting appointment that I had to prioritize. So I am just kind of here to absorb what I can.
All right, great. So, and I just realized after I said your name, Andy, that I said I wasn't going to put him on the spot, and then I immediately put you on the spot. So I apologize for that.
It's okay.
There is, so just so you know, there is a recording from this morning. And so if you want to go back and listen to it, or you can go back to the WIOA Summit recordings and see the entire presentation from back in April. So though you do have those options if you want to get any of the information that our presenter, Zach Gibson, presented this morning. So.
I do, thank you.
And then Tara, do you want to take it away and talk about our discussion questions?
Absolutely. Andy, yeah, we're glad you could come this afternoon, and certainly we'll have some important topics. And Tammy, it's good to see you. You know, I was talking with another colleague in preparation for today, and she was saying that she has a couple of friends who are youth counselors, and at this point, they are out 4 weeks out just for intake and 6 to 8 weeks out to get people in for their services. So this is something that truly is such a key issue and something we all need to be aware of and informed about, you know, as we help young people and really kind of work through a lot of these issues from the pandemic and beyond. So we have some questions here, and these are the same questions that we provided in a couple of ways before the presentation this morning, but just to kind of go through them together. And Andy, it worked out well that we kind of have done it this way. And there are actually questions that were provided to us by the presenter. So I thought we'd kind of look them over real quick and just talk about them, and then we can kind of go back through them, and we have an interactive board to use as we do that as well. So the first of our discussion questions, he kind of grouped them actually. I'll let you take a look here so as to not read the slide, but then I had a couple of thoughts. Okay, so I was thinking back to a couple of points in the presentation this morning and beyond. You know, as a teacher and a trainer, I think it's really important to think about how all of these things are affecting us as well. Just as when we're talking about reflection and curriculum and such, we do the same. So I'm going to move on to the next slide. So this morning we heard, and you know, we have plenty to talk about from our own situations as well, but we heard a couple of ideas of what some of these barriers might be and how to deal with them. So I'm really looking forward to kind of sharing ideas of what we've noticed in our worlds and what we learned from this morning and in our own lives, you know, how we can help our participants and ourselves. So let's move on.
If you don't mind, I'd like to throw in here, because Zach said so many great things this morning, and that's actually the second time that I got to hear him. So I have some wonderful notes, but one of the things that I really enjoyed that he said about engaging is not saying, why aren't you engaging? but instead saying, what's the barriers? What's keeping you from engaging? And I just really thought about how different that is, instead of why am I not doing something that that you want me to do? It's kind of an accusatory, as opposed to, hey, I want to find out what the barriers are. So I definitely am making that change in how I interact with people and how I ask questions. I thought I can use that in a lot of other places besides just this particular question. I was like, oh, there's a good one. Keeping this one.
Me too, in my house as well. Okay, and here's the next slide. I'll let you take a moment with that. I thought this was such a great question for this setting and this group, because professionally, I feel as though we represent partnerships. So just the people who are on here right now represent different centers, different areas of focus, but yet our partnerships are necessary for our success and truly benefit our students and our participants. So I'm really looking forward to this too. Okay, so as we move forward to the actual discussion part, this one, just like all the others, I'm looking forward to hearing what we think about this, but I really found myself looking a lot at the second part. How do these systems accommodate for mental health needs? Which is something that this morning was a little eye-opening. We have so many considerations, but I feel like I need to focus on that a little bit more intentionally. So that one really resonated with me, actually, that question right in the middle. So we thought we'd just kind of start out by previewing the questions that we're going to be talking about. And I have some notes from this morning, and Sarah said she did as well. And I'm going to hand it over to Sarah, because to aid our discussion and also to give people choices and how you'd like to participate, we have a Padlet. So go ahead, Sarah.
Thanks, Tara. And yeah, so hopefully you can see my screen now. We have our WIOA professional development that's starting out there, and we've got a couple of the first questions. They're not all on there because Zach gave us a lot of questions, which is great, because hopefully that'll spark some great conversation. First of all, let me ask you, have any of you used Padlet already? Are you familiar with it?
I'm somewhat familiar with it, yes.
Okay, all right. Tara, can you put the link if they want to go there? So as Tara already said, let me just reiterate, you guys get to interact in any way that you wish, especially with this small group. We can do whatever we want. So if there's a question that resonated with you and you'd really like for us to start with that one, speak up. And if there's something, but you have the power obviously to unmute and to talk, and we'd like to hear what you're thinking. If you're the type of person that would rather write your answers, you can go to the Padlet, and basically you just go to the comment. The first question that Zach provided for us was, how have you personally adapted to life during and post-pandemic? And then you can actually write something in there and see if you wish. And you can also, just because, as teachers, we're always learning and we love our new resources, our new tools. If you wanted to, you can go down to this lower right-hand corner and press plus, and then you can put your own question in if you have another question that you'd like for us to consider. So, all right. So does anybody feel comfortable, want to start with how you have personally adapted to life during and post-pandemic? What changes have happened for you in the last year and few months? I don't know what.
I can start. This is Tammy. I mean, obviously, working remotely has been the huge one, and adapting to that has been a challenge, but it's been a good one too. I think we've learned a lot on how to work, remotely, and how to reach out to people. And I'm honestly kind of thinking this type of an exercise, like I said, I don't deal directly with participants, but I work with programs. This type of an exercise might be something that would be good for a WIOA system, and to do this with our WIOA staff and discussing the post-pandemic and how things are going to move forward.
Tammy, which partner do you work for? What's your?
I'm WIOA, so we're Title I. We have the local workforce investment areas that we work with. So I'm DCEO, Department of Commerce and Economic Opportunity.
Okay, great. And so Tara and I are both in adult ed, and Kirsten is from the CTE, the Career and Technical Education side of the house. And Andy, where do you work?
I'm in DCEO as well with OET.
Okay. All right.
But, in relation to this particular question, and I don't want to tread too much here because I wasn't in the initial presentation, but I did come from a Title II program in Wyoming, and the big challenge we had was moving our instruction to virtual, and particularly with our English as a second language students. English is a very mouth mobile language, and that doesn't always translate even with the highest quality cameras out there.
Yeah, for sure. I think, Tammy, you mentioned that these conversations, how do we move forward? And I hear that all the time now in meetings that I'm in, is like, okay, how do we are opening up, we are getting together more. How do we make that transition? How do we keep everything that we've learned? Because I think that's one thing that I've heard from a lot of people, is that we've all had to learn a lot of new tools and new skills. So how do we keep that and use that? And to your point, Andy, how do we incorporate that, but move to whatever our new normal is?
Yeah, I agree. And to piggyback, just an anecdotal, one of my friend's daughters works for a low-income school and special education. And one of the things she's identified, it was some of her autistic children are thriving doing virtual learning because they don't have the distractions as much. So they're doing very well doing the Zoom calls compared to what they did in the classroom. So things like that I think are definitely going to be takeaways of how to educate too, and how people are, how successful they've been in this type of an environment, or how, they've not been successful, one or the other.
Right. I think one of the things that we have more options. So, as Andy was talking about with English as a second language students, they might choose one thing, whereas Tammy, you're talking about somebody on the spectrum, they might choose another. And how can we make that okay for different people to have different choices of how they interact and how they learn? So, all right. Veronica, welcome. Yes. Yeah, okay. All right. So I will tell you guys, just from a personal standpoint, I have a hearing impairment. And so I can tell you that being on Zoom has been great for me, because I can make it as loud as I want. I can turn down all the background noise. It's wonderful. And as I've started to go back out into more crowded situations, like, oh yeah, this is what I remember when it was hard to hear. So I think that we do want to think about, besides the anxiety and all of the things that Zach talked about today, is like, what barriers might be there that we can possibly overcome with our technology. Okay, and Veronica's microphone's not working, but welcome. And so Veronica, you can still put things in the chat or on the Padlet. Tara, do you want to take us through some of the comments that are on the yellow question?
Absolutely. So the first one is actually mine. And I thought a lot about technology this morning, because we were talking about anxiety, for everyone. And I think sometimes technology can cause and ease anxiety or the feeling of anxiety. I think it was important too that Zach talked about helping people when they feel anxious. Don't worry, you're not always anxious for an anxious person, but this is making you feel anxious, and what can we do about it? We've talked a lot about that as teachers and trainers, about really showing people how to use pieces of technology. But I think one of the big life changes in terms of my work that happened is adding technology to my home. And we have faster internet. I have different hardware now, and we think about that a lot more. There's a lot more, what's going on with the internet? Unplug it and plug it back in. And but also, I mean, a lot of us are fortunate to have to work for places that support us with those pieces of technology a lot, but it adds cost a lot of times as well with your internet and such. And I think that kind of jumps over to that second question. How might these adjustments pose a challenge for our participants? But then that also jumps to some of our other questions about connecting them to resources that financially it can be a burden. I think for our participants to be able to adjust to some of this technology that we need to be able to function in the ways that we are now. So I think that we've learned a lot about options, and I'd like to talk about that just because I feel like I always love to hear ideas about how we can help people connect to resources. So that was kind of some thoughts that I had. And then I don't feel like I've adapted post-pandemic. There are still so many things up in the air. I was just thinking about that when Andy was talking about the mouth mobile language that we speak. I agree 100%. So if we go back and we're wearing masks with our ESL students, is that better? Seeing our mouths is a big deal. So there are a lot of questions up in the air, and I'd have to agree. Does anyone want to elaborate further on that one?
Well, it's just Tammy. I have to agree with you because everybody talks about going back to normal, but what is normal now? So, I think as we were going into this whole pandemic, there was a lot of, wondering what was going on, how long it was going to last, what's going to happen. And now coming out of it, it's the kind of the same feeling. Okay, so what is it going to be like? What's our life going to look like post this? Because it's probably not going to be exactly like it was pre. And like with us, we're going back to work, I think 2 days a week starting in July and then 3 in September. But, is that, how's that going to look and feel when we get back in the office?
Right. And so for Tammy and Andy and Veronica, are you seeing clients or participants in the office? Are you seeing people, students, clients, participants?
No, I'm not public facing. So I'm behind developing and running programs.
Okay.
So I'm not public facing at all.
Okay.
And I'm not really public facing in this role. But I'm hearing the frustrations of those that are.
Yeah.
That's kind of all over the board. Some really want to open their doors back up, but can't for various reasons because a partner is located with them can't, or their facility is just not designed very well. It's kind of all over the map. I don't, there's going to be a bunch of micro solutions everywhere. No one size fits all.
Right. So do you feel yourself, okay, I see Veronica. So all three of you then, do you find yourself still focusing a lot on virtual settings when you're even working behind the scenes, designing and such for virtual type settings or not face-to-face? Yeah. Okay. And how do you feel like that's affecting the participants, clients? How do you refer to people? Clients, students? Oh, customers. Okay, Veronica put customers. Okay.
Well, like you said, my customers are the providers, the people that are offering the services. So it's not like end user, it's not direct to, the youth or adults who need the services. So, really my customers are providing the resources to the people that actually do the work with the customers.
Okay. And how do you feel like this has all been affecting them?
I mean, I think it's been different, like I said, across the board. We've had some of our providers that have kind of really been open for a period of time and seeing customers, face to face or by appointments. And then we have others based upon their, geographic area that are not. So Andy said it's just good. It's going to be it's not a one size fits all environment.
Absolutely. And Andy, I liked that word micro solutions, because I feel like we're going to have to, sometimes change the format, even as we move back to, like Tammy said, the new normal, which who knows what that'll be. Mm-hmm.
And I think there's a big difference when we, last spring, it was like everything was it was mandated very quickly. The change happened quickly. And now we're coming back a lot slower pace. We're considering, basically we were shut down, and now it's like, okay, what do we open? What do we not open? And some of you have mentioned about different partners. Some of them are more open, some of them are less open. I think it's also interesting as I have conversations with people that some people have been out there the whole time. I know some people that work in healthcare, they've always been out there working. They haven't really changed. Some of their protocols have changed and the hours that they work have changed, but their jobs, they're still going to work every day. Whereas I just walk to a different room and turn on my computer. That's my commute. So it's very interesting to think about how we each make those different changes. Does anybody have any thoughts on the green post-it is what adjustments have you made to better accommodate your emotional and professional needs? Because Zach did take us through some ideas, some strategies. What have you worked on to help you to accommodate yourself? Besides getting better internet that Tara has.
Yeah, I was going to say, a lot of it is just adapting the technology and getting, accustomed to that. And, and learning, how, the communication skills via technology.
Right.
And Zoom call.
For sure.
I feel like too, and I think it's something that I definitely felt this morning that Zach was emphasizing is, I feel like personally, I've had to be a little bit more intentional about a different work-life balance. I think sometimes I'm like, well, it's right there. I should go and just finish that real quick. But then sometimes I think, no, well, I'm still gone then, from my family. So I think sometimes we're uber productive when we're at home, which can be great. But Zach's presentation overall was very much, it was reflective. And that encouraged us to take part in that for ourselves, but also for our customers, students, participants to be considerate, of that, and to sort of promote some skills to look inward on that, and also provide some organizational ideas and self-care, promoting self-care, which I think is really important. And it's something I don't probably spend, enough time thinking about or talking about in the classroom or in different trainings. So what do you guys think about that?
Well, I just have to admit, I'm probably the worst person to talk about the pandemic and self-care in the same sentence. So I think I did everything I could to make this the craziest time, including a cross-country move and all that. So yeah, I don't have much to speak on this topic.
Well, do make sure to go back and watch Zach, because even his presence, I feel like, is soothing and instructive about how to start to promote a little self-care. Don't you think, Sarah?
Absolutely. And you know what, Andy, I totally hear what you're saying. I'm kind of laughing. It's like you took every stressor in life, I guess, and put it on top of the pandemic. So way to go on that. But I think one of the things that I took away from Zach's presentation the first time, and then it was just solidified this time, is being mindful. Because I don't think, I'm like Tara. I grew up in a large farm family, and it was like, just work hard, get over it, kind of was the message. And so I think it took me a while to go, okay, this is hard. I need to accept the fact that this is, there's things about this that are really, really hard. And even though I don't think I have it nearly as hard as many other people, and I think that's why I thought that I should be fine, is because I kept working. I had access to good internet. I live in a house that, I wasn't worried that I was going to lose my house. So all those kinds of stressors weren't there for me, but it's still, it's a lot. It's definitely a lot. And I think another point that Zach made that really hit me was, especially talking to young people, is to call out the fact that this is unprecedented. None of us were alive in the last pandemic. We don't, we don't know how to come back, because we've never done this before. We have to figure this out. We have to have those solutions all through the day, and hopefully we'll be better by it. But I think even just being mindful that letting younger people know that, yeah, we're kind of fumbling as well. It's, So Veronica says she started mindfulness apps. It seems to help adjust exercise. Yeah. You know what, Veronica, that was another thing that I realized very early on, that I needed to move, because I just needed like an outlet for that anxiety. And but I think there's been a big increase on those mindfulness apps too. And Andy, Zach did take us through a couple of exercises. So again, I really encourage you to go back and watch that, because I think it's very helpful.
Will do. Thank you.
Yeah, let's see. So yeah. Somebody put that learning how to work at home is a skill with itself, how to channel from work, the office distractions. Yeah, for sure. I mean, that's kind of what Tara was talking about too. Whenever you've got kids in the house, or even if you don't, there's a lot of distractions. How do we channel that?
Well, that said too, there's a lot of distractions at work. So that's
True.
one of the, you don't have the copy, talk. I hear dog, and that's usually my biggest distraction, is my dog's in the background. But yeah, I agree. But I do think there's distractions in both places.
It's a very good point. Yeah. And you know what? So since Tara and I are both in Title II in education, we have told teachers all along, because moving to all remote learning for some of our teachers has been extremely stressful. We're like, hold on, remember when you were in an in-person classroom, things went wrong then too. So maybe it's something different that's going wrong, but there was really no days where everything on your lesson plan came out perfectly, and everything, you were figuring out how to adjust on the fly back then. This is just a different way to adjust on the fly. So I love that you pointed that out for returning to the office, Tammy, because you're absolutely right about distractions. Sometimes there's less distractions working from home too, because you don't have coworkers that come and maybe plop themselves down, or you can mute them, that kind of thing. Okay, are we ready to move on to the white post-it note? It's the next question, and it's multi-leveled. Think about a participant, and I know most of you said that you're not at that level, but if you think about either a participant or somebody that you've worked with within your organization, so kind of make it personal to you. And if they had trouble engaging, and are you able for that person, or maybe if it's for you, can you think of a possible external barrier for engagement? Can you think about something that possibly you can even help them with to decrease that barrier? Okay. Either this question is not resonating with us, which is fine, or you don't have anything they want to share, so that's fine. If you want to come back to this one and put something in, okay. Yeah. Children and childcare, there could be asynchronous option for training or class. You know, it's interesting because Tara and I have encountered many a person now with a child on their lap as they're going through our virtual training, and that's something new that didn't happen before this. And childcare options. Yeah. Any thoughts about what's on the screen so far?
You know, I guess one of my comments is I think the pandemic has escalated some things that needed to be escalated that were probably in the planning process, but were maybe 5 or 10 years down the road. So just like I said, even the way people are, you know, are learning, educated, with the way people are working. I think some of this was going to happen, you know, and I've heard, you know, media and stuff saying that, but I definitely think it escalated some of this, which is not necessarily a bad thing.
I 100% agree, you know, and maybe it does seem like in many instances, whether it be a Title I setting or Title II or corporate, that a hybrid setting might be somewhat ideal. So you can balance those work and home distractions and productivity, but necessary interaction, you know, both socially and professionally. So maybe not always and not for everyone. There's not a one size fits all. And that's another, I think, idea in itself that really, it was escalated, promoted, brought to the forefront, like Tammy said. But this last idea about childcare brings me to, I think, one question, you know, and hopefully you have some ideas, even from your community, from your work, to kind of talk about different resources that you know are available. So it kind of leads to the next question. You know, how do our systems accommodate for mental health needs? And if they don't, how can you advocate for temporary or permanent systemic change to improve engagement and outcomes for folks? So whether that be connecting them to resources for mental health or life needs. So what are some of the resources that you know of, or ways that you can advocate for that change? I'd love to hear some ideas from people around the state.
I mean, I guess my opinion is it needs to be a federal and a state change in policy in the way that we deal with mental health. You know, I know at once years and years ago, a lot of it was institutionalized, which was not a great scenario, but then it was, you know, decentralized and the states took care of it. And then they kind of put people on the streets. So there needs to be better planning and policies around it and how to work with individuals and meet their specific needs when it's, you know, looking at mental health. I run an opioid grant right now, and even the stigmatisms around that, how to get rid of those stigmatisms around individuals that need assistance. So, and I don't know what the answer is for, you know, federal and state.
Since you're working specifically in that area, do you feel like there's improvement happening?
At least with what who I'm working with, yes, I feel like they're trying to change the language, and they're, you know, especially when dealing with addictions, you know, talking about how it's a brain illness, and you know, and changing that stigmatism of like, oh, they're just, you know, they're just a drunk or they're just on drugs or whatever, to the fact that this is a brain issue. And, you know, when they're in and, you know, trying to rehab and doing well, they relapse. And it's like, you know, it's no different than if you're on, you know, blood pressure medicine and you quit taking it. Or you have diabetes and you don't take your medicine. I mean, it's something that you need to treat it as an illness and not as an addiction. So then that language, I think, is definitely changing. You know, I think they're trying to make that change.
That's so good to hear, Tammy. And it's probably something that we can all internalize a little bit. You know, what language do we use that we can start with us? You know, what could we change in our own language? But what I'm hearing too is you feel like policy change is something that we should focus on to improve our systems.
Yeah, I think that policies definitely drive what happens, with programs and how they manage for sure. But yeah, and just with the grant that we're working on, I think the thing that's been good is the relationship between workforce and like the mental health system, because they have to lean on each other. They each have their very specific, things that they do, and the language in mental health is, a little different than the language in workforce. So they really have to lean on each other, which is, I think, we talk a lot about service integration, and that, to me, this is a real good example of service integration, because they need each other.
So you do feel like that partnership is fairly strong?
Yeah, I mean, it's growing. I won't say it's strong, but we only have 5 areas that are doing the specific projects, and I do definitely think the project help them to grow these relationships. But there's a lot more work that needs to be done with it too.
Tammy, thank you for sharing your
Yeah.
experience with that. I'm just taking notes. I internalized.
Yeah,
them.
I wrote that one down too, Tara. I'm like, okay, we need to explore that more, and we need to probably shine a light on some good practices that we can grow from. Because as you said, Tammy, policy does drive, but also whenever you see nothing creates success like success. If you have some successful situations and you see progress and you can shine a light on that, I think that's really helpful. It made me think also whenever Zach was talking about mental health, the tennis player now that's kind of been in the news, and I really don't follow tennis a whole lot, but her name's Naomi Osaka. I think I have that right. And I don't know if you've heard about that, but she withdrew from the French Open, I think it was. So feel free, anybody, to correct my facts here, but basically she withdrew from a very big tournament and basically just said, I need to sit this one out, and came under some fire. But then since then has had a lot of people stepping up. And I think that has created a climate for conversations, which is good. It's healthy to have those conversations to try and reduce some of that stigma.
That's true. Great connection. I just posted an article that I read about that, about how her situation is opening up some really important conversations. Yeah. Great connection.
Have you guys personally had anybody in your work world? And I know Andy has changed his work world during the pandemic, but have you had people who like left their jobs? Have you found people that are like, this is too much and I just need to step out? Is that something you've seen?
I mean, I have not personally seen that. I think most of it is individuals that are being laid off, quite a few, because we have the warn notices in our office. So that, that's the thing, is we're having a lot of individuals laid off. I know somebody that I'm working with, her brother-in-law was laid off from Nickelodeon, which we wouldn't think he'd be laid off from that, and he's an older individual. So finding a job at the level he was at, makes it difficult for older workers.
For sure.
So, I mean, and you're going to see, we're seeing that right now in the car industry because of the chips, the semiconductor chips or something. So I know that there's layoffs going on in the car industry because the supply, chain isn't there for that yet. So, but as far as actually leaving a job, and then of course, we've got with the stipends and the stimulus, we're having a lot of people that just are not going to go back to work. So I know in workforce, we're having a hard time finding bodies of people to come in and train and get back to work. And we're competing with employers now, as you can see this, help wanted signs everywhere. So it's just a totally different dynamic than I think we've ever experienced with this right now.
Yeah, I agree with everything that was just said. I can only add that I did see several early retirements. People just didn't want to go through a transition, even if it was temporary, or weren't that comfortable with the thought of working from home because they were from a different school of thought when it came to work. So.
Yeah, that's what I've seen is some earlier retirements where people are like, I'm not going to do this. Especially I had some teachers early on that said, I can't teach like this. This is not for me. So I'm going to step out. All right. All right. Tara, do you mind putting our 4th question up? Did you do that other one for me? And it just appeared. I assumed you
I
magically.
sure did, yes.
Thank you. I love when things magically appear where they're supposed to. Great.
And I kind of combined this in terms of conversation, but let's take the bigger question from that last one.
We'll go to this one. Is this what you're doing? Is number 4?
Yeah, so I kind of put number 4 up already over here.
Okay.
My cursor,
Okay.
I'm doing this like you guys can see it. So we kind of talked about that already, but so now I'm going to go back and to the 3rd question there. And that was around the whole personhood. So I put that up in the Padlet. And yeah, it's considering the whole person when we support others. How can you support your participants to care for their whole personhood while trying to succeed for program tasks and goals? That's such a good question. What are your thoughts? I should add that part. While trying.
Well, I think one of the things that's come to mind is because it seems like the majority, if not all the people that are on this conversation have positions where they are somewhat influential about what types of training and services that people could get that are frontline, person-centered, person-facing, I think was the term that you used. Tammy, that was a new term for me, so thanks for teaching me a new vocab. But I think maybe possibly giving them some of the tools that they need to feel comfortable. And one of you mentioned about having conversations or maybe facilitating conversations amongst groups or amongst offices. I don't know, what are your guys' thoughts around that?
I could say, and with the workforce hat that we're wearing, I mean, they need to collaborate. We're big on doing service integration right now and looking at regional approaches. But you know, workforce is good at what workforce does. But if you have somebody that needs the mental health, services, or the addiction services, or if even like homeless, I mean, they're good at connecting people potentially with homeless or food. But everybody, you need expertise. You can't bear it all on yourself, and you need to make sure you bring in the experts that are good at what they do, and not try to do it yourself. And I think that's one of the things with the opioid grants, where the grantees, they were trying to bear a little bit more of what the mental health side was, what they shouldn't be doing. They should be just collaborating with the mental health side and working this problem together.
I think so too. I think that the more conversations, the more collaborative efforts that we can all engage in to connect our customers, students, participants to what they need, and each other. I think sometimes, seeing this today reminded me that, we need to do this in the workplace as well, and make sure that people are connected to the resources that they need.
Right. One of the things that has really hit me in this last year is I do feel like in a lot of ways that people have practiced grace to an extent that I haven't seen before for years and years. I mean, like, oh, I'm having technology difficulties. Everybody's like, oh, okay, we got you, man. We're going to hang with you. And even the first time that session that we replayed this morning, the first day that it was presented on the WIOA Summit, we had some tech issues, and it was amazing to me that everybody was kind of like, okay, we'll just wait. Okay, you know, I mean, it was nice to see kind of that support for each other, and understanding that maybe we need a little more space sometimes, some patience. It's like, okay, everything's not going to go exactly right, and that's okay. And so I'd sure like to see that continue a little bit. But Tammy, I put in on the Padlet, bring in experts, because I think that's really important also, is to know what we can do and what is beyond our abilities, and bring in people who can help.
And I think too, I mean, having collaborative meetings today, this is focused on the discussion this morning and kind of around these areas of anxiety in youth and the workplace and our settings, our different settings. But even just hearing a little bit about what you do, Tammy, I've thought of a couple of students, you know, who I wish that, you know, I knew a little bit more, at least I know where to send them, just because in my position, I feel like I've been lucky to learn a little bit more about some of the centers and efforts in my area under workforce, kind of the workforce umbrella. But the more meetings we could have about this and just kind of telling each other about what we do and where we're from, I think could be beneficial to all of our participants, all of our students, and people in the offices, so that, you know, I could know about some of these programs and grants and efforts and partnerships that I could connect some of my students to, and vice versa. We should have like quarterly meetings that we all get together and just tell each other what's going on, I think, in our worlds, or kind of use some of the resources that we've created. I find myself going to the different websites a little bit more now, just to stay educated on what's happening in these other areas, but I'd like to spread that. You know, what are your thoughts on that?
Oh, I agree. I agree with you. I guess one of my peeves with the whole pandemic, and maybe even the CDC, is and that the messaging has always been, you know, separation, wear your mask, do this, but they don't give any messaging about, like my husband had COVID, and his doctor's like, you need to take vitamin D, you need to take zinc, you need to take a baby aspirin. You know, there's certain things that, you know, or how to develop an immune system that is going to be healthy, that can combat it. And I felt like it was always talking about the evil and not things that you can try and do to, you know, to prepare yourself. And like I said, that's just my little beef with this whole thing, is that the messaging sometimes, you know, you just don't want to talk about the doomsday, but you got to say, okay, this is what we can do to make us better, you know, to go through whatever situation it is.
I agree. And if we can kind of keep that spirit as we move forward for our students and our customers, I think that they'll benefit in the end if we collaborate too, and kind of, you know, keep that spirit about, let's connect you to resources and do what we can to take care of each other. Mm-hmm.
Well, I'm going to grab Andy's verbiage that he had about 30 minutes ago, that micro solutions is looking at how can we move forward? How can we work together? How, you know, so I love that. It's thinking about how can we collaborate and work effectively. Right. Other thoughts or comments or action items that anybody's thinking of from this presentation, this conversation? So thank you, Veronica, for sharing about a community resource group and having meetings monthly. That's great. Yeah. You know, the other thing I think about that is not even just being aware of what's out there, but knowing people, because then you can say, oh, I can call up or send a message to Andy because I know him, or to Tammy or to Veronica. That's very different than saying I need somebody to do this ambiguous task and I don't know anybody who does it. And so it's very different. Those relationships are very important.
So I already added a couple of my big takeaways from our conversation today to the Padlet, but I think that'd be good. If you're willing to add a takeaway or something that you're going to take from our conversation and use it personally or for your customers, that would be great. I think it's always good to identify something that we can use from what we've discussed and learned today. And while you're thinking about that, just to kind of remind everyone about some of the resources that have come up today. So in our chat this morning, or in the webinar this morning, we had posted the connection to the recording. So if you go to, or Kirsten, if you want to post it really quick, you can go to the WIOA Summit website and you can watch the full recording of Zach Gibson's presentation, and but also posted on the ICSPS website will be the recording from today's session. So there were some spots that were cut out from his original presentation. So in there, you'd get to kind of see what everyone watched this morning. And really the only spots that we cut out were kind of the introductions in the beginning and a few of those technology issues that Sarah had mentioned that everyone was super understanding about. And then some of the breakout room, smaller discussions that happened throughout his presentation were cut out. So if you want to watch that recording from the WIOA Wednesdays on the ICSPS website, you can do that. So those are kind of two ways that you could watch. Thank you. Zach's presentation. And thank you, Kirsten. And then also available are the notes, the questions in a fillable PDF format. Those are available on the website in conjunction with today's WIOA Wednesday webinar as well. So in case you wanted to look at those or use them for further discussion, we're all about using and reusing some of the professional development opportunities that we have available. So just wanted to mention those couple of things. Sarah or Kirsten, did you want to add any of those kind of housekeeping items at all, or did I get everything?
No, I believe we are good. Sarah, do you have anything?
Nope, I think that you covered it all, Tara. Thank you for wrapping us up and for showing where they can get those resources. And I think Zach's slides are also available. So if you want to look at those are all there for you. But thank you for joining us. This was a new format. We weren't really sure if people would be interested in coming and having a conversation. And we said, let's just try it. Let's just see what happens. So I hope that you all will keep the conversation going with all of the people that you have influence with. And thank you for joining us today. And thanks for sharing your thoughts. We really appreciate everything that you do.
Absolutely.
Thank you.
Everyone. Thank you, everyone.
Everybody have a great afternoon.
You too. Bye.